I'm going to be demonstrating treating the Sibson's fascia. So there's a balanced ligamentous tension and a myofascial release technique that I'd like to do for this. So the driving the bus myofascial release technique or balanced ligamentous tension technique, I'm going to be kind of contacting the, I have the clavicle between my index and middle finger right over here. And then I'm contacting the first rib and the first thoracic vertebra with my thumb posteriorly here. Okay, so I'm getting that entire Sibson's fascia kind of unit circled around my hands like a bus wheel. Okay, and then I'm just going to feel collectively, what does the bus like to do here? Does it like to flex, extend? It likes to extend. Does it like to kind of side bend to the left or to the right? Likes to side bend more to the left. And which way, when I kind of drive the bus, it likes to drive more to the right. So it's rotated to the right. So I'm going to stack all those planes, and then I like to do this indirectly for most injuries that I see in a more chronic kind of sense. And I'm going to have you take a breath in and out, and hold that breath out as long as you comfortably can if it's more of an indirect approach. And again, once they get to that point of air hunger where they feel like they need to take that breath, very often that's where you feel that fascia kind of release itself. And so that tends to be an excellent technique to treat Sibson's fascia right around here. But let's say that we want to do it more unilaterally, and we want to really, and we have a lot of tension kind of going on in the Sibson's fascia area. So I'm going to do a standing position to treat the ipsilateral side right over here. So I'm going to be using their arm, so I step on the inside of their arm. I'm going to grab just above the elbow, relax your arm, I got you here. With my cephalad hand right over here, I'm going to be feeling on the medial aspect of Sibson's fascia, just kind of hooking with my, notably my first two fingers right over here, or my index and middle finger. And I'm also just looking at their face, making sure it's not too uncomfortable, but I'm kind of hooking in there, and then I'm just feeling the tension with the arm, so I can adjust how much pressure I have with my hand, and then I can adjust the amount of abduction, adduction, internal, external rotation, as well as how much compression in or traction out. And I'm going to be doing this a little bit more directly, so I'm trying to take it into that barrier until I feel it's kind of releasing itself. And if I'm doing it directly, I can have them take a deep breath in and hold it in to really use that respiratory to be able to help release it a little bit quicker. Okay, and that already softened up there, relax, okay? And then I'm just going to move a little bit more lateral on the Sibson's fascia right over here to kind of get that point a little bit wider on the clavicle right over here. Same kind of thing. Just adjust it how you need to with all those planes of motion. Use the respiratory cooperation and relax, okay? And again, you can watch their face, make sure you're not putting it in uncomfortable position.